Welcome, dear friends, to a conversation that could truly change your life, or perhaps the life of someone you cherish. Imagine maintaining your independence, continuing to enjoy your hobbies, and embracing every precious moment with your loved ones, without the shadow of a serious health crisis looming. What if I told you that your body, with its incredible wisdom, is already sending you critical warning signals right now, trying desperately to protect that future? These aren't just the aches and pains or normal aging excuses we often tell ourselves. No, these are urgent, whispered messages from your very heart, signals that could genuinely save your life, but they're so subtle, so easy to dismiss, that most people, over 6 million Americans living with heart failure every year in fact, tragically overlook them until it's nearly too late. Here's the shocking truth that medical research continues to confirm. Many of us are unknowingly dismissing these crucial early symptoms as nothing more than everyday stress, being a bit out of shape, or simply getting older. But behind these seemingly innocent complaints, your heart could be screaming for attention, battling in silence to tell you something absolutely vital. Today we're going to pull back the curtain and reveal 13 early signs of heart failure that are so often missed. You might be surprised to learn that a simple symptom, like a sudden struggle when you bend down to tie your shoes, or why you've started propping yourself up with extra pillows at night just to breathe comfortably, could be a key indicator. By the time our conversation ends, you'll be empowered with precise knowledge of what to diligently watch for, and more importantly, when it's time to speak with a doctor to safeguard your most precious asset, your heart. This information is powerful, truly life-saving, and entirely within your grasp. Please understand, this video is designed purely for educational insight and should never replace the professional medical advice of your healthcare provider. All the information shared is backed by verified research, with references readily available in the description below. Now let's begin to uncover these life-saving warning signs, starting with the first indicator that often signals heart trouble: shortness of breath during activities that used to be easy. Many people tend to brush this off as simply getting older or being out of shape. But it's a critical early symptom. We're not talking about being winded after an intense workout, but rather feeling breathless after gentle activities like climbing just a single flight of stairs or even just walking to your mailbox. According to extensive research from the American Heart Association, this type of exertional dyspnea is recognized as one of the earliest and most common symptoms of heart failure. What's fundamentally happening inside your body is that your heart isn't efficiently pumping enough oxygen-rich blood to meet your muscles' demands during even moderate physical activity. When your heart struggles to keep up, your breathing becomes labored as your lungs have to work overtime to compensate for this inadequacy. The crucial difference between normal tiredness and a heart failure symptom lies in its progression. If you notice that tasks that were once effortless now consistently leave you breathless, or if you find yourself needing to stop and rest frequently during routine tasks, this is your heart unmistakably signaling for help. Medical studies consistently show that this specific symptom often appears months before other more obvious signs of heart failure become apparent, making it extremely important not to dismiss this as merely a sign of being out of shape. Next, we move to a symptom that often creeps up so gradually that individuals don't immediately recognize it as abnormal: needing more and more pillows to breathe comfortably while sleeping. This condition, medically known as orthopnea, is a powerful telltale sign that your heart is struggling to pump effectively and efficiently. When you lie flat, gravity no longer assists your heart in pumping blood back from your legs and lower body. If your heart is already weakened, this can cause blood to back up into the pulmonary veins, which are the vessels responsible for returning blood from your lungs to your heart. This backup, in turn, causes fluid to leak into your lungs, making it increasingly difficult to breathe comfortably when in a supine position. Research from leading cardiology centers worldwide indicates that orthopnea is present in approximately 80% of patients diagnosed with heart failure, highlighting its prevalence and significance. What makes this symptom particularly subtle and dangerous is its slow development. You might initially add just one extra pillow, then eventually two, and perhaps eventually find yourself needing to sleep in a recliner because it's the only position where you can breathe without difficulty. Many individuals tend to rationalize this change as a mere preference or a comfort issue, But if you've transitioned from sleeping flat to needing multiple pillows or even sleeping upright just to breathe properly, your heart is undeniably conveying an important message about its struggling function. Imagine the terrifying experience of waking up suddenly in the middle of the night, gasping desperately for air, feeling as if you're quite literally drowning. Your heart is racing, panic sets in, and you find yourself needing to sit up or even stand to try and catch your breath. This distressing experience is called paroxysmal nocturnal dyspnea, and it represents a very serious warning sign of worsening heart failure. This alarming symptom occurs because when you've been lying down for extended periods during sleep, the fluid that has accumulated in your legs and other lower extremities throughout the day begins to redistribute itself throughout your entire body, including significant amounts returning to your lungs. Your heart, already compromised and struggling, simply cannot handle this sudden increase in fluid volume, which then causes acute shortness of breath severe enough to abruptly jolt you awake. Clinical studies indicate that these episodes typically occur 2 to 4 hours after falling asleep and can be among the most frightening experiences for individuals living with heart failure. Those affected often report rushing to an open window or door, frantically seeking fresh air to alleviate the suffocation sensation. What makes this symptom particularly dangerous is that many people frequently attribute these episodes to benign causes like nightmares, anxiety attacks, or general sleep apnea. While these conditions can certainly cause sleep disturbances, the specific pattern of waking up gasping for air, especially if it becomes more frequent or severe, unquestionably warrants immediate and thorough medical evaluation. The fourth major warning sign is perhaps the most commonly dismissed: an overwhelming and persistent fatigue coupled with significantly reduced exercise tolerance. This isn't the ordinary tiredness that typically improves with a good night's rest. Instead, it's a profound, persistent exhaustion that continues despite adequate sleep and makes activities you once enjoyed feel utterly impossible. When your heart fails to pump blood efficiently throughout your body, your system intelligently diverts blood flow away from less critical organs, like your muscles and extremities, and prioritizes sending it to vital areas such as your heart and brain. This diversion means your muscles receive substantially less oxygen-rich blood, leading to profound and debilitating fatigue and generalized weakness. Studies consistently show that this type of symptom can manifest months, sometimes even a year or more, before other more obvious signs of heart failure become apparent. What is particularly concerning is how this fatigue dramatically impacts exercise tolerance. You might notice that your recovery time after any physical activity, no matter how minor, becomes dramatically longer than before. A short walk that once left you feeling energized now demands a lengthy period of rest. Even routine daily tasks, such as carrying groceries, climbing a few stairs, or simply taking a shower, become exhausting ordeals. The progression of this fatigue is often so gradual that people unconsciously adapt their lifestyles, starting to avoid certain activities, making excuses, or wrongly blaming it on simply getting older. However, this progressive decline in stamina is far from normal aging. It's a strong indication that your heart is struggling immensely to meet your body's most basic needs for oxygen and nutrients. Moving on to a highly visible early sign, we identify swelling in your ankles, feet, or legs, medically known as peripheral edema. This isn't just the temporary puffiness you might experience from prolonged sitting or standing. Rather, this is a persistent and progressive swelling that typically worsens significantly by the end of the day. When your heart can't pump effectively, blood doesn't circulate properly throughout your body and consequently begins to pool in your lower extremities. Additionally, with reduced blood flow, your kidneys receive less volume, triggering them to start retaining excess sodium and water in an effort to maintain what they perceive as normal body fluid levels. This unfortunate combination of poor circulation and fluid retention forces fluid from your blood vessels into the surrounding tissues, directly causing the noticeable swelling. Research published in prominent cardiology journals consistently shows that peripheral edema is present in approximately 70% of heart failure patients at the time of diagnosis, emphasizing its commonality. The swelling typically initiates in the feet and ankles, often progressing upwards to involve the calves and sometimes even the thighs. You might notice that your socks leave deep, persistent indentations on your skin, or your shoes feel uncomfortably tight by evening, or that rings which once fit perfectly now feel too snug. The pattern of swelling is also vitally important. Heart failure-related edema is usually symmetrical, affecting both legs equally and noticeably worsens throughout the day due to the constant pull of gravity. If you gently press on the swollen area and it leaves an indentation, known as pitting edema, that stays for several seconds, this is a strong and definite warning sign that merits immediate attention. Perhaps one of the most measurable and critical early warning signs of heart failure is rapid weight gain, directly attributable to fluid retention. We are emphatically not discussing the gradual weight gain that occurs from overeating or reduced activity. This is a sudden and significant increase in body weight that can happen remarkably quickly, sometimes over just a few days, and it should immediately trigger alarm bells for both you and your doctor. Medical guidelines from the American Heart Association specifically state that gaining 2 to 3 pounds in a single day, or 5 pounds or more within a single week, warrants an urgent call to your healthcare provider. This rapid weight gain occurs because your failing heart triggers a complex cascade of hormonal responses within your body, causing your kidneys to aggressively retain both salt and water. Critically, each kilogram of weight gained in this context represents approximately 1 liter of excess fluid that has accumulated in your body. Studies emphasize that this type of sudden, fluid-related weight gain often happens before other, more obvious symptoms, like visible swelling or noticeable shortness of breath, become overtly apparent. This is precisely why many doctors advise heart failure patients to weigh themselves daily at the same time and with the same clothing. It serves as a highly sensitive early warning system that can often prevent more serious complications, including hospitalizations. The weight gain stemming from heart failure is distinctly different from normal weight fluctuations. It's consistent, upward trending, and often accompanied by a distinct feeling of bloating or uncomfortable fullness in the abdomen. A symptom that frequently puzzles individuals and is often misattributed is suddenly needing to urinate much more frequently at night than during the day, a condition known as nocturia. While many people attribute this to the natural aging process or simply consuming too many fluids before bedtime, it can actually be a very important early sign of heart failure that is regrettably often overlooked. During the daytime hours, when you are upright and active, the constant pull of gravity causes fluid to accumulate and pool in your lower extremities as your struggling heart cannot effectively pump this fluid back up to your kidneys for proper processing and excretion. However, when you finally lie down to sleep at night, gravity actually assists in redistributing this pooled fluid back into your overall circulation. Your kidneys, which suddenly receive this unexpected flood of fluid that has been accumulating throughout the day, then work overtime to process and eliminate it, resulting in a significant increase in urine production that requires multiple trips to the bathroom. Research published in various cardiology journals demonstrates that nocturia can be among the earliest indicators of heart failure, sometimes even appearing before more prominent symptoms such as noticeable shortness of breath or overt swelling become apparent. Patients frequently report waking up 3 to 4 times, or even more, per night to urinate, with each episode producing larger volumes of urine than they would typically expect. This specific pattern is particularly significant because it clearly represents your heart's underlying inability to effectively handle and regulate normal fluid distribution throughout the day. A persistent cough that specifically seems to appear only at night or when you are lying down is another subtle yet highly significant warning sign of potential heart failure. This isn't the kind of productive, chesty cough associated with a common cold, nor is it the dry, irritating cough often caused by allergies. Instead, it's frequently described as a nagging, dry, and often non-productive cough that typically disrupts sleep and usually improves significantly when you sit upright. This nocturnal cough occurs due to the exact same mechanism that leads to orthopnea. When you lie flat, the fluid that has accumulated in various parts of your body throughout the day redistributes, and this can lead to a mild but noticeable fluid buildup within your lungs. Your body's natural, protective response to this perceived fluid presence in the airways is to cough, instinctively attempting to clear what it interprets as an obstruction. Medical literature frequently describes this cough as often being worse in the early hours of the morning, and in some cases, it may even be accompanied by a slight wheeze. Patients commonly report that this cough produces very little to no sputum, or occasionally, they might bring up white or even pink-tinged frothy mucus, which is a stronger indication that fluid is indeed present in the lung tissues. What makes this symptom particularly deceptive is that many individuals often blame it on completely unrelated factors such as allergies, post-nasal drip, or simply the environmental conditions of their sleeping arrangements, missing the critical message their heart is trying to send. Your heart's rhythm provides crucial early warnings about the state of its health, and sensations like palpitations or an irregular pulse often accompany the initial stages of heart failure as your heart struggles harder to pump blood effectively. Palpitations are described as the unsettling sensation of your heart fluttering, pounding forcefully, or noticeably skipping beats within your chest. When your heart muscle begins to weaken and function less efficiently, it may develop irregular rhythms, arrhythmias, as it desperately struggles to maintain adequate blood circulation throughout your body. You might find yourself feeling like your heart is racing uncontrollably, even when you are completely at rest, or you may experience the deeply unsettling sensation of your heart actually skipping beats. Some individuals describe this feeling as though their heart is doing somersaults or flapping inside their chest. Research from major cardiology centers around the world shows a clear and intricate relationship between cardiac arrhythmias, particularly atrial fibrillation, and heart failure. These conditions are often both a cause and a consequence of one another. This relationship is often bidirectional. Irregular heart rhythms can, over time, directly lead to the development of heart failure, and conversely, an already failing heart can trigger dangerous and potentially life-threatening arrhythmias, creating a vicious cycle that can rapidly worsen if left unaddressed. These palpitations are often more pronounced and noticeable during periods of rest or when lying down, and they may frequently be accompanied by feelings of anxiety or a generalized sense of unease. While palpitations can stem from a wide variety of causes, when they appear consistently alongside other concerning heart failure symptoms, they most definitely warrant immediate and serious medical evaluation. Dizziness, episodes of lightheadedness, or feeling like you are about to faint, near fainting episodes, can be frightening and highly significant early indicators of heart failure. These symptoms occur primarily because your weakened heart simply cannot pump enough blood to maintain adequate circulation and deliver sufficient oxygen to your brain, especially during changes in position or during periods of physical exertion. When a healthy individual stands up quickly or engages in physical activity, their body normally compensates by rapidly increasing the heart rate and adjusting blood vessel tone to maintain a stable blood pressure and ensure proper brain perfusion. However, a failing heart lacks the capacity to make these vital adjustments effectively, which can lead to temporary but concerning drops in blood flow to the brain. This insufficient blood flow then manifests as feelings of dizziness, lightheadedness, or in more severe instances, actual fainting. Clinical studies consistently indicate that syncope, or fainting, occurs in approximately 20% of heart failure patients and can indeed be one of the early warning signs, sometimes appearing even before other, more overt symptoms become apparent. These episodes are frequently triggered by sudden movements, prolonged periods of standing, or even mild exertion that would have previously had no effect on you. What makes this particular symptom dangerous is the tendency for people to attribute it to other common causes, such as dehydration, side effects from medication, or problems with the inner ear. While these conditions can certainly cause dizziness, when it is combined with other potential heart failure symptoms, recurrent dizziness or near fainting unequivocally represents a serious decrease in your heart's ability to pump blood, known as cardiac output. It might seem unrelated, but persistent abdominal bloating, a noticeable loss of appetite, or experiencing a feeling of fullness after eating only small amounts can actually be crucial early signs of heart failure. These seemingly digestive symptoms occur because heart failure doesn't solely affect your heart. It profoundly impacts your entire circulatory system, including the vital blood flow to your digestive organs. When your heart struggles to pump effectively, the blood flow to your gastrointestinal tract inevitably decreases. Additionally, fluid, which is being retained throughout your body, can start to accumulate within your abdomen, a condition known as ascites, and your liver can become noticeably congested with blood that isn't being efficiently pumped away. This unfortunate confluence of issues creates a cascade of digestive problems that can significantly diminish your quality of life. Research consistently shows that these gastrointestinal symptoms are frequently overlooked by both patients and healthcare providers because they are often incorrectly perceived as unrelated to heart problems. Patients often report feeling uncomfortably full after consuming just a few bites of food, experiencing persistent nausea, or having a bloated sensation that simply doesn't resolve with typical digestive remedies. The liver congestion that develops in heart failure can also lead to noticeable pain or discomfort in the upper right side of the abdomen. Some people describe a constant dull feeling of pressure or uncomfortable fullness in their belly, which makes eating normally extremely difficult and further contributes to poor appetite. Here is a symptom so specific that most people have never even heard of it, yet it's one of the most telling early signs of heart failure: bendopnea. This is not just general breathlessness, it is a very specific type of shortness of breath that occurs consistently within 30 seconds of simply bending forward. Think about everyday actions like tying your shoelaces, picking up a fallen object from the floor, or even leaning over a sink. This peculiar symptom, bendopnea, was first scientifically characterized in medical literature as recently as 2014, and subsequent research has clearly demonstrated that it is a remarkably specific and reliable indicator of elevated pressures within the heart. When you bend forward, the physical position naturally increases pressure within your abdomen, which in turn pushes against your diaphragm and temporarily raises the pressure in your chest cavity. If your heart is already struggling with elevated filling pressures due to existing weakness, this additional sudden stress can very quickly trigger pronounced shortness of breath. Studies published in leading cardiology journals have found that bendopnea is present in approximately 30% of heart failure patients and is strongly associated not only with more advanced stages of the disease, but also with an increased risk of mortality. The symptom is so consistently reliable that many researchers and clinicians now consider it a non-invasive and highly effective way to assess the pressures inside the heart, often without needing more invasive diagnostic testing. What makes bendopnea particularly significant and a powerful warning sign is its very high specificity. Healthy individuals almost never experience this symptom, making its presence a strong signal for further medical investigation. Our final warning sign involves subtle yet significant changes in your circulation that you might start to notice in your extremities. Persistently cold hands and feet, even in warm weather, or a less obvious indicator known as narrow pulse pressure. These signs can collectively indicate that your heart isn't pumping with sufficient force to maintain proper and robust circulation throughout your entire body. When heart failure begins to develop, your body instinctively prioritizes blood flow to your most vital organs, primarily your brain and your heart itself. To achieve this, it reduces blood circulation to less critical areas, such as your hands and feet. This reduction in peripheral blood flow leads to persistently cold extremities, which can sometimes be accompanied by a faint bluish tinge to your fingernails or lips, a sign of reduced oxygenation. You might notice that your hands and feet feel perpetually cold to the touch, even when you are otherwise warm, or that they take a significantly longer time than usual to warm up. Narrow pulse pressure is a more subtle sign that requires a blood pressure monitor to detect. Normally, there should be a difference of 40 millimeters of mercury, mmHg, or more between your systolic, the top number, and diastolic, the bottom number, blood pressure readings. When this crucial difference significantly narrows, it can strongly indicate reduced stroke volume, which means your heart is simply not pumping out enough blood with each individual beat. Medical research demonstrates that these circulatory changes often develop gradually over time and can be important early indicators of a progressively decreased cardiac output. If, after listening carefully, you've recognized yourself in any of these 13 warning signs, please do not panic, but critically, do not ignore them either. Heart failure, when it is caught and addressed early, is a remarkably manageable condition. The crucial step is recognizing these subtle but vital signals your body is sending you and taking proactive action before a medical emergency potentially occurs. The most important thing to always remember is that these symptoms often develop gradually, almost imperceptibly, and can be remarkably easy to dismiss as inconsequential. You might be tempted to think you're simply just getting older, out of shape, or under a lot of stress. However, when multiple symptoms begin to appear together, or when familiar, once easy activities suddenly become unexpectedly difficult and strenuous, your heart might genuinely be telling you something absolutely critical about its well-being. Early detection and prompt, appropriate treatment of heart failure can dramatically improve your quality of life, maintain your independence, and significantly increase your longevity. Modern medicine offers incredible tools and strategies to help manage heart failure, ranging from advanced medications that can strengthen your heart's pumping ability to carefully tailored lifestyle changes that can slow, or even, in some cases, partially reverse the progression of the disease. Take charge of your heart health today.